Okay, so after the last video on the Center for Disease Control's COVID-19 comorbidity tables, that third digit left me still perplexed as to why there was not a closer distribution. So what I did was I went back into that table and I deleted all the columns that had nothing to do with the data. I found a couple other columns, an age range. They shouldn't have affected the data, but I just wanted to see if I deleted all the columns that were not related to the data, if I'd get a different output. And I basically didn't. I ran it on the first digit and got basically the same similar distribution, maybe slightly less. I can't remember, but this looks like it could be slightly less than it was on the last video. And on the second digit, again, it was very, very similar. Downward sloping distribution conforming to the overall Benford's distribution. On this sample, we got it down to 74,421 records. And on the third digit, believe it or not, again, it reported basically the same spotty distribution. So it wasn't anything that was erroneous in the data set that I had used, because now I've got it down to just the COVID-19 data. Um, so with that said, and not being able to dig into any raw data, I'm going to shelve that for now. And what I decided to do was go over to the World Health Organization's website and take a look at their table. What they have over here is a table basically of every country in the world and all the cases that were reported. And you can see here just globally there's 235 million cases reported globally. So it's not isolated in any manner at all to any specific region in the world. So what I did was I outputted this table and ran it through the tool to see what it was going to produce over here as far as Benfords. So I'm going to load up the table real quick and run Benfords. Here you can see it's the WHO COVID-19 global table. And on the first digit, again, we have basically a virtually perfect distribution as to what would be expected. Here we have 1,947 records. The first digit, the second digit, not so perfectly distributed, but it does have a downward sloping trend on the distribution. Nowhere near as good as the CDC data set. And on the third digit, again, similar to the CDC third digit, the distribution is kind of sporadic and does not basically conform to what's expected at all. So without having access to the raw data on either one of these tables, it's kind of difficult to break down any reasoning why this could be happening. So for now, I'm going to shelve it and basically conclude that the COVID-19 data as reported through the CDC as well as the World Health Organization, the reported statistics do conform to what's expected on a natural set of numbers. Remember, this is not a tool to diagnose fraud. This is just going to indicate whether or not the data conforms to what's expected of a natural occurring set of numbers. And this definitely does on the first digit and for the most part on the second digit of the CDC COVID-19 comorbidity tables. So that's going to wrap up this video. Hope you enjoyed, and please stay tuned and check out my channel for other videos applying Benford's Law to the current events. Thank you very much.